So there are numerous benefits to be working in private practice, but the 5 big benefits that I see for moving from NHS into private practice is number one is that you get quality time with your patients. Now, when we talk to patients about private practice, you say you get to spend more time at the dentist. They quite often recoil and say, why would I want to spend more time? However, it is so important that our clinicians are able to, one, build relationships with the patients so that they are treating patients who like them and patients that you like as a clinician. And you can only do that by spending time with them to be able to then communicate appropriately and treatment plan and co-diagnose with the patients. And the second one is that those appointment times allow you enough time to think, process and actually carry out the treatment in the most appropriate way. So we're not a treadmill that the NHS system is often seen as to try and make it work as a system. So having extended appointment times, having comprehensive health reviews, we go into more depth with our full assessment and 16-point dental health reviews, the whole co-diagnosis and the absolute removal of those rushed 5-minute, 10-minute checkups. You know, as I've seen before when I worked in the NHS, 25-minute crown preps, unheard of in our group. So what we do is focus on that quality time. So that's number one. Number two is do more of the dentistry that you enjoy, okay? So we work with a TCO system. We have fantastic front of house team members, and that whole system allows the kind of pre-qualifying of the right patients to come in to see you. I had a discussion yesterday with one of my dentists who says, I really don't want to be the guy that does the full dentures. Okay, no problem. We have another dentist in the practice who really loves using our 3D denture system. And so what really is the focus there is to get to do more of the dentistry that you enjoy, okay? Now that can be most commonly really high quality restorative dentistry. Okay, that's what a huge portion of what we do, you know, and then we also have the other things, you know, the cosmetic, the orthodontics, and really just the whole kind of surgical, restorative, cosmetic breadth of what we offer, and making sure that everything is built around that solid base of a high quality periodontics within our practice, which is the foundation of really high quality restorative dentistry. So really the focus, do more dentistry you enjoy, and you get more of that through our system and working in private practice that's not dictated by an NHS system. The third one is that you have a better work-life balance. Now we talk about work-life balance a lot. It varies from person to person, but all of it is just life. And in my view, and the way that we look at things in the pain-free group, is that 4-day weeks are the norm, and certainly no more than 4 days clinically. And we want you to have free time. The whole point in working is so that you can enjoy your home life, you can spend time with your family, you can have great experiences, whether that be holidays and living the lifestyle that you wish, and have that headspace and that time that are available to wind down. So not having to be in a practice 5 days a week, you know, churning through different types of treatments to patients to try and make a system work, and then having to do your notes, your records, prior approvals and things, you know, all late nights and evenings and weekends. We want a better work-life balance, and private practice can afford that for you. You get to control your own destiny. Okay, now you have clinical freedom. There is no SDR regulation or obligations of what you can do to a tooth and what you can't do to a tooth. You're there to work in the best interest of the patient. As I said, there is no prior approval. There's no search for discounted labs to try and find something that's to a degree of acceptable quality. We want you to be doing work that you're proud of, and we have a price point appropriate for that. And that allows you that freedom to deliver the dentistry that you're trained for and that you're engaged with and that you're proud for another dentist to see. Okay, so really, really important that you have that control of your own destiny, and removing yourself from the SDR is, in our view, one of the greatest ways to do that. And then the fifth one is you also see earnings that reflect your commitment. So typically our associate dentists on a pro rata basis are earning over, at the early stages of working within the pain-free group, is over 140,000. And that's typically seen as working on that 4-day week, working efficiently with a great team, a very efficient nurse, outstanding treatment coordinators that have patients that are predisposed, pre-interested, pre-engaged with the types of treatments that you wish to offer, and really getting that skill mix in there to be able to deliver types of variations of dentistry you enjoy as you maybe move forward into finding it your niche or what you like to do more of. And what we like to do with that is before you start and before you accept a position within the pain-free group, we'll go through a full record of projections of where we see that your earnings are going to be, because different skill mixes are coming into our practices. You have different levels of planned patients, different areas of demand within the practice. So we're able to spell that all out for you and make it really clear. Although there is individual variation of what you're bringing to the practice in terms of your own clinical skill mix, we're there to support you and provide that pathway to really, over the first kind of 12 to 18 months with us, is just to really build on that. So speak to our team if you want to know more about our projections of your income and the earnings that reflect the skill mix and commitment and being appropriately remunerated for the high skills that you're bringing to patients who really enjoy the rewards that you're providing for them and the value that you provide for them. So 5 big benefits to moving to private practice. If you want more information, have a contact with our team. Let's have a chat and let's see how we can help you.